Welcome to the Make It Make Sense series from Northwest Access Fund, where we try to make sense of complicated benefits questions. Today we're talking about different ways to access Medicaid. Let's imagine we have a person who is in need of healthcare in Washington State. We'll call him Norman. We want you to have healthcare, Norman. We're going to imagine that Norman comes upon a house called the Medicaid house. It's a metaphor, Norman. If Norman can get into this house, he'll have access to all the basic services offered to anyone who qualifies for Medicaid. This includes primary care, emergency visits, maternity services, dental services, vision care, and prescriptions. He won't pay copays for any of these services. The house also has a studio, which has home and community-based services, also called waiver services. If Norman meets some extra rules, he may be able to get those services too. Let's figure out how to get Norman into that house. You'll see the house has 5 doors, 2 on the bottom floor and 3 on the top floor. The bottom floor we're going to call the non-disability floor. Norman can get into the house by using the doors on this floor if he meets the income eligibility requirements and he doesn't have a qualifying disability. The doors on this floor are labeled Child Magi and Adult Magi. Magi stands for Modified Adjusted Gross Income because these are both income-based eligibility groups. Adult Magi is for adults between the ages of 19 and 64 who are at or below 138% of the federal poverty level and meet other requirements. Child Magi is for children under age 18 whose families have income at or below 215% of the federal poverty level and meet other requirements. If Norman fits through either of these doors, he gets into the Medicaid house and gets access to all basic services. Remember, the Medicaid house has 2 floors. Let's explore the top floor, which is the disability floor. To get through any of the doors on this floor, Norman will have to have a qualifying disability and will need to go through a disability determination process. There are 3 commonly used doors on the disability floor. Let's look first at the SSI door. SSI stands for Supplemental Security Income, and it's a monthly payment for people with disabilities who meet certain income and asset limits. If you qualify for SSI, you are automatically eligible for Medicaid. If Norman qualifies for SSI, he can get into the Medicaid house on the disability floor through the SSI door. The next door on the disability floor is labeled the 1619B door. It's related to the SSI door. You can use the 1619B door if your SSI dropped to 0 because of the earnings from a job or self-employment. There is an income limit for the 1619B door, but it's really high. You can have about $57,000 a year of earnings in Washington and still use this door as long as you meet all the other SSI rules. Lots of people get into the Medicaid house through the SSI door and then later go through the 1619B door when they start working. Since all the doors get you into the same Medicaid house, your services don't change if you change doors. The next door on the disability floor is labeled HWD. HWD stands for Healthcare for Workers with Disabilities and is also known as Medicaid Buy-In. This door is for people with disabilities who are working. This door is mostly used by people who have Social Security disability insurance and are working, since people with SSI can use the 1619B door when they work. But if someone with SSI has earnings and assets above the 1619B limit, they could use the HWD door too. To use this door, you must have a qualifying disability and be working. It's okay if the work is part-time. If your income is high enough, you'll pay a monthly premium, which will never be more than 7.5% of your income. One of the greatest things about the HWD door is that there is no income and no asset limit. All these doors are a potential way for Norman to get into this house of Medicaid, and regardless of the door he uses, he'll have access to all the same Medicaid-covered services. There's also a studio on the side of the Medicaid house that has home and community-based waiver services. The waiver services studio has extra services, like in-home medical services, in-home personal caregiving services, community services, and more. Exactly which waiver services you get depends on which waiver services program you qualify for. That's a whole other video, Norman. We'll talk about that another time. The thing about the waiver services studio is you can only get through one of the doors on the disability floor, the SSI 1619B or HWD door, or the door on the studio called the 300% door. To use the 300% door, you have to be eligible for waiver services and have income below 300% of the SSI benefit amount. If you are going through the child or adult Magi doors on the non-disability floor, you can't get into the studio and get waiver services. Sorry, Norman, we didn't make the rules. The good news is, if you came in through the wrong door, you can try to get in through another one by meeting the eligibility requirements for that door. These aren't all the doors, but they are the most common ones. Thanks for watching the Make It Make Sense series, Access to Medicaid.